Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Hearing problems in children. Introduction. Most children hear and listen to sounds from birth. They learn to talk by imitating the sounds around them and the voices of their parents and caregivers. But that's not true for all children. Many children are born deaf or hard of hearing. More lose their hearing later during childhood. Many of these children may need to learn speech and language differently, so it's important to detect deafness or hearing loss as early as possible. This program reviews the different types of hearing problems that affect children. Information about the causes and treatment of hearing loss is also presented. Anatomy of the ear. Our ears are very specialized organs that allow us to hear and to keep our balance. Each ear has 3 sections. 1. The outer ear, which includes the auricle and the ear canal. The ear canal leads inside the ear to the eardrum, or tympanic membrane. 2. The middle ear, which is formed of 3 small bones known as the ossicles. 3. The inner ear. The outside part of the ear is known as the auricle. It acts like a satellite dish to collect sound waves, which are vibrations in the air. The sound waves enter through the ear canal to the eardrum. The eardrum vibrates, causing the 3 small bones of the middle ear to vibrate and send the vibration to the inner ear. The vibrations sent to the inner ear are then sent to a special organ inside the inner ear, known as the cochlea. The cochlea has a snail-like shape. Inside the cochlea, the vibration is changed into electrical signals. A nerve called the 8th nerve carries the electrical signals to the brain, where they are understood as sounds. Hearing loss in children. Hearing loss can happen when any part of the hearing mechanism is not working in the usual way. Hearing loss may be temporary or permanent. There are 4 types of hearing loss. Auditory neuropathy spectrum disorder, conductive hearing loss, sensory neural hearing loss, mixed hearing loss. Auditory neuropathy spectrum disorder is one type of hearing loss. This type happens when sound enters the ear normally, but the sound isn't organized in a way that the brain can understand it. This is due to damage of the inner ear or the hearing nerve. Conductive hearing loss is caused by something that stops sounds from getting through the outer or middle ear. Conductive hearing loss can often be treated with medicine or surgery. Sensory neural hearing loss is caused by a problem in the way the inner ear or hearing nerve works. It is the most common type of permanent hearing loss. Unlike auditory neuropathy, which prevents sounds from being understood by the brain, sensory neural hearing loss prevents a person from being able to hear the sound. Mixed hearing loss includes both a conductive and a sensory neural hearing loss. Hearing loss may be mild, moderate, severe, or profound. Depending on the cause, hearing loss can be stable or it can get worse or better over time. It can happen in one or both ears. A person can also have different types of hearing loss in each ear. Hearing loss can be present at birth or happen later in life. Hearing loss may happen before or after a person has learned to talk. When hearing loss occurs during the developmental years, all areas of a child's development can be affected significantly. Childhood hearing loss can affect the development of communication, language, and social skills. A child with hearing problems develops these essential skills late or not at all. The earlier children with hearing loss start getting help, the more likely they are to reach their full potential. If you are a parent and you suspect your child has hearing loss, trust your instincts. Speak with your child's healthcare provider right away. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. The symptoms of hearing loss are different for each child. If you think that a child might have hearing loss, ask the child's healthcare provider for a hearing screening as soon as possible. Signs of hearing loss in very young children, such as newborns and infants, may not be easy to notice. Hearing problems may become more noticeable when a child is 12 to 18 months old. This is the time when children should begin saying their first words. Children with hearing problems often react to their environment by using their other senses, especially sight and touch. This can mask their hearing problems. Therefore, it is important to know some of the signs and symptoms to look for. It is important to remember that hearing problems can develop at any time. Even if a child has passed a hearing screening before, it is important to continue monitoring for problems. Your baby may have a hearing problem if he or she doesn't startle at loud noises, turn toward the source of a sound, say single words, such as dada or mama, by 1 year of age. A baby with a hearing problem may also seem to hear some sounds but not others, turn their head when they see you but not when you call out their name. Signs of hearing problems in children include delayed speech, speech that is not clear, often saying, huh? Turning the TV volume up too high, not following directions. Causes. Hearing loss can happen any time during life, from before birth to adulthood. About 50 to 60% of hearing loss in babies is due to genetic causes. Some babies with a genetic cause for their hearing loss might have family members with hearing loss. About 30% of babies with genetic hearing loss have a syndrome. This means they have other conditions in addition to the hearing loss, such as Usher syndrome or Down syndrome. Infections passed from mother to baby during pregnancy, complications after birth, and head trauma account for 25% or more of hearing loss in babies. In about 25% of all cases of hearing loss in babies, the cause is unknown. Hearing loss that happens later in life can be caused by many things, including infection and injury. Screening and diagnosis. Diagnosing a hearing loss takes 2 steps: hearing screening, full hearing test. A hearing screening can tell if a child might have hearing loss. Hearing screenings are easy and are not painful. All babies should have a hearing screening no later than 1 month of age. Most babies have their hearing screened while still in the hospital. If a baby does not pass a hearing screening, it's very important to get a full hearing test as soon as possible. This should happen no later than 3 months of age. Children should have their hearing tested before they enter school or any time there is a concern about the child's hearing. All children who do not pass a hearing screening should have a full hearing test. Full hearing tests may include auditory brainstem response, ABR test, behavioral audiometry evaluation, otoacoustic emissions, OAE. If you think a child might have hearing loss, ask a healthcare provider for a hearing screening as soon as possible. Early treatment can help your child to continue developing important social skills. These skills may be more difficult to learn later on in life. Treatment. There are many different options for children with hearing loss and their families. There is no single treatment or intervention that works for every child or family. Good intervention plans will include close monitoring, follow-ups, and any changes needed along the way. Research shows that early intervention can greatly improve a child's speech, language, and social skills development. Babies that are diagnosed with hearing loss should begin to get treatment as soon as possible, but no later than 6 months of age. Special education programs are also helpful. Special education is instruction specifically designed to address the educational and developmental needs of children with disabilities or developmental delays. These may begin at age 3 and continue until a person is 22 years old. For children that have some hearing capabilities, implants or devices can help improve hearing loss. These include hearing aids, cochlear implants, bone-anchored hearing aids, other assistive devices. These implants and devices will assist with hearing, but they cannot cure hearing loss. Hearing aids make sounds louder. They can be worn by people of any age, including infants. Babies with hearing loss may understand sounds better using hearing aids. This may give them the chance to learn speech skills at a young age. A cochlear implant may help with severe to profound hearing loss. It gives that child a way to hear when a hearing aid is not enough. Unlike a hearing aid, cochlear implants do not make sounds louder. A cochlear implant sends sound signals directly to the hearing nerve. Bone-anchored hearing aids may be used. Bone-anchored hearing aids are specifically made for children who cannot otherwise wear in-the-ear or behind-the-ear hearing aids. There are many other devices that help people with hearing loss. A healthcare provider can help you learn about the many devices available. Medications or surgery may also help make the most of a person's hearing. This is especially true for a conductive hearing loss, or one that involves a part of the outer or middle ear that is not working in the usual way. One type of conductive hearing loss can be caused by a chronic ear infection. Most ear infections are managed with medication or careful monitoring. Severe cases may need to be treated with surgery. Family support. Without extra help, children with hearing loss have problems learning language. These children can then be at risk for other delays. Families who have children with hearing loss often need to learn special skills to help their children learn language. These skills can be used together with hearing aids, cochlear implants, and other devices that help children hear. For many parents, their child's hearing loss is unexpected. Parents sometimes need time and support to adapt to the child's hearing loss. If you are a parent and suspect your child has hearing loss, speak with a healthcare provider right away. If hearing loss is detected, ask about the many resources available to you, your child, and the rest of your family. You can learn how to manage the hearing loss together.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Many children are born deaf or hard of hearing. More lose their hearing later during childhood. In children, hearing loss can affect the development of communication, language, and social skills. A child with hearing problems develops these essential skills late or not at all. Hearing loss can happen when any part of the ear is not working in the usual way. This includes the outer ear, middle ear, inner ear, hearing nerve, and auditory system. Hearing loss may be temporary or permanent. Hearing loss can vary greatly among people and can be due to any of a number of causes. The symptoms of hearing loss are different for each child. The earlier children with hearing loss start getting treatment, the more likely they are to reach their full potential. There are many different options for children with hearing loss and their families. No single treatment or intervention is the right answer. Good intervention plans will include close monitoring, follow-ups, and any changes needed along the way. If you are a parent and you suspect your child has hearing loss, trust your instincts and speak with your healthcare provider right away. Thank you for using Explain.